My name is Amanda Sheehan, and I'm a nurse practitioner at the Joslin Diabetes Center in Boston. Today I'm going to be giving you an overview of how to obtain CGM for your patients. For the overview, I'm going to talk about how to obtain the devices. So how do we obtain a CGM for our patients? I think it's important to let our patients know that it's going to be a process. It's not always instantaneous. It may take 2 to 6 weeks or longer, depending upon coverage. So patients will need to look at their insurance coverage to determine if and how their insurance will cover the CGM device. For those without a CGM benefit or without coverage for durable medical equipment, FSAs or HSAs can be used as an alternative. Medtronic does have a CGM access discount. Dexcom has a patient assistance program. The Libre has a 14-day free trial, and Eversense has a patient assistance program as well. Care Credit, which is a health and wellness credit card, can also be used. It's also to remember what are the out-of-pocket costs for these devices, because they do vary a great deal, and depending upon your patient's resources, some may be unattainable, whereas others might be somewhat more feasible out of pocket. So the Libre 2, the reader, is between $103 and $140. As you know now, you don't really need a reader to begin using the device. So patients can just purchase the sensors and use their smartphone in lieu of the reader for checking the sensor glucose. A 90-day supply of sensors from the last data that we have was $385 for a 90-day supply, which works out to about $1,540 per year. Dexcom, 3 sensors for the G6 cost $346 to $482 depending on where they're purchased. And a 90-day supply can run between $900 to $1,200. One transmitter alone is approximately $300, again, depending on where purchased. Medtronic sensors are $60 per box, $720 per year. A single transmitter can be typically $180, again, depending on where purchased. Eversense, which is currently approved for a 3-month wear, is $533 per month, $6,400 per year. This would include the visit for insertion and removal. Now I'm going to talk about pharmacy versus durable medical benefits. So, does the patient have coverage via durable medical or a pharmacy benefit? If it's covered under durable medical, the CGM is considered durable medical equipment, and patients may require a prior authorization and documentation, including recent visit notes. These notes will need certain criteria within them. The CGM is supplied then through the durable medical distributor, and so obtaining the CGM, the process may take 2 to 4 weeks. If it's covered as a pharmacy benefit, the provider simply sends the script to the pharmacy. This is a much quicker process, so it can take hours to days. Some companies that cover medical supplies also cover pharmacy benefits, such as EdgePark. So note that for Eversense, patients will have to determine coverage for the device as well as for the procedural visit for the insertion. Now FDA approved for 6 months of use as of the second quarter of 2022. Therefore, these appointments are now biannual versus quarterly, so that should help with the cost. So what is the durable medical benefit process? The steps are the patient provider, we have a discussion, we talk about the CGM, the patient needs to obtain the phone numbers for the durable medical suppliers. Then the patient should contact the durable medical supplier to request the CGM. This is typically done by phone. The DME company talks to the patient, they'll discuss what is covered, what are the costs, and approval to the DME company is required to avoid delays. Sometimes patients are a little bit confused by this process, but really they're not used to contacting companies directly to obtain supplies, but this is the very necessary first step in order to get the ball rolling in terms of paperwork. Because at that point, after the DME company has talked with the patient, they send the provider a certificate of medical necessity. And this form must be filled out by the provider and faxed back to the DME company. It should also include a recent visit note, a recent A1C, and then often glucose monitoring data may also be requested. DME processes the form, and then the device is sent to the patient. And then the patient should schedule the patient-provider education appointment. So oftentimes, sensors, patients will lose a sensor will fall off, a sensor or transmitter will no longer function. Patients, what should they do? So they'll often call the provider and say, can you send a new script, or what is the best method to address this failed device? So patients should actually contact the manufacturer directly. So Medtronic, Dexcom, and Abbott have tech support numbers for this purpose. It's important to remember also, though, that there may be a delay. However, I always say that it's important every time there is a technical issue with the sensor or transmitter to let the company know so that in the future these glitches or problems can be addressed. Thank you for listening, and if you'd like to learn more about time and range, please visit the American Diabetes Association's Time and Range website at professional.diabetes.org/time and range.